Do you know what ADHD is? ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that affects both children and adults. It's characterized by ongoing patterns of inattention, hyperactivity, and impulsivity that interfere with daily functioning or development. This isn't about a person being hyper or unfocused every once in a while. We're talking about behaviors that are persistent, often severe, and have a real impact on a person's life. In this video, we'll delve into the world of ADHD, examining its traits and signs, exploring treatment options, and discussing prevention strategies. We'll break down complex medical terms and research findings into easily understandable language, providing a comprehensive overview of this often misunderstood condition. So, whether you're a healthcare professional looking to expand your knowledge, or someone who suspects they or a loved one might have ADHD, this video is designed to provide valuable insights. If you want to better understand ADHD, keep watching. What makes ADHD unique? Its traits. In trying to understand ADHD, it's essential to delve into the key traits that define this condition. These traits, namely impulsivity, hyperactivity, and inattention, are the cornerstone of ADHD, but they can manifest differently in each individual. Impulsivity is a significant trait of ADHD. It's the tendency to act on a whim, without thinking of the consequences. Picture someone who blurts out answers before a question is completed, has trouble waiting their turn during games or conversations, or makes hasty decisions without considering the potential risks. This is the essence of impulsivity, and it's a common thread among those with ADHD. Next, we have hyperactivity. It's not just about physical movement, as many might assume. It's also about the mind. Individuals with ADHD often have thoughts that race from one idea to the next, making it difficult to focus on one task at a time. Physically, it might manifest as constant fidgeting, an inability to sit still, or a sense of restlessness that just doesn't seem to subside. Then there's inattention. This trait is characterized by difficulties in maintaining focus, especially on tasks that require sustained mental effort. It's not so much about an inability to pay attention, but more about the challenge to keep that attention focused. It could look like forgetfulness, an easily distracted nature, or difficulties in following through on tasks or instructions. But here's the thing. Even though these traits are commonly associated with ADHD, they're not exclusive to this condition. We all can be impulsive, hyperactive, or inattentive at times. It's the intensity, frequency, and impact of these traits that set those with ADHD apart. And it's also important to remember that these traits can present themselves differently depending on the individual's age, environment, and other personal factors. For instance, hyperactivity might be more apparent in children, while inattention might be more noticeable in adults. These traits, however, are not enough to diagnose ADHD. So, how can you spot ADHD? Look for the signs. Attention Deficit Hyperactivity Disorder, or ADHD, manifests itself differently across various age groups and can vary greatly from person to person. However, there are some common signs that can help us recognize this disorder. Let's start with children. It's normal for kids to have trouble focusing and behaving at one time or another. However, in children with ADHD, these troubles are more severe and occur more often. They may seem to be in constant motion, have difficulty sitting still during quiet times, and may talk excessively. They may have difficulty paying attention, even when spoken to directly. They might make careless mistakes in schoolwork, have difficulty organizing tasks, and often lose things necessary for tasks or activities. Adolescence brings its own unique set of challenges. Teenagers with ADHD may have difficulty with self-control, leading to impulsive behaviors. They might struggle with schoolwork, often forgetting to complete assignments or losing track of deadlines. They may have difficulty maintaining friendships due to impulsivity and a lack of focus. It's also not uncommon for these teens to engage in risky behaviors. As we move into adulthood, the signs of ADHD can become more subtle but are no less impactful. Adults with ADHD may have difficulty managing time, organizing tasks, or completing work within deadlines. They may have problems with relationships, self-esteem, and addictions. They might seem forgetful and have difficulty focusing on a conversation. However, it's important to remember that these signs can be indicative of various conditions, or even just the normal ebb and flow of life's challenges. So these signs alone are not enough to diagnose ADHD. A comprehensive evaluation by a healthcare professional is necessary for a proper diagnosis. It's also essential to understand that not everyone with ADHD will display all these symptoms. Some might have issues with attention, but not with hyperactivity or impulsivity. This is what makes ADHD a complex disorder to identify and manage. One more thing to note is that ADHD is not a one-size-fits-all condition. It's a spectrum disorder, meaning its symptoms can range from mild to severe. Some people with ADHD have fewer symptoms as they age, while others continue to have significant symptoms as adults. The key lies in understanding that these signs and symptoms can impact every aspect of a person's life, from work to relationships to self-esteem. Recognizing these signs is the first step towards seeking help and managing ADHD effectively. Now that you know the signs, what can be done to manage ADHD? ADHD can be managed. Let's explore how. As we delve into the realm of treating ADHD, it's important to understand that there is no one-size-fits-all approach. The best treatment plan is often a mix of various strategies, tailored to the individual's unique needs and circumstances. Firstly, medication is a common component of ADHD treatment. Stimulant medications, such as methylphenidate and amphetamines, are often prescribed. These drugs boost and balance levels of neurotransmitters, which are chemicals in the brain involved in thinking and attention. Non-stimulant medications, like atomoxetine or certain antidepressants, are also used in cases where stimulants don't work or cause undesirable side effects. These medications can help increase attention span, focus, and emotional control. However, like all medications, they come with potential side effects and considerations, which should be discussed with a healthcare professional. In addition to medication, therapy plays a crucial role in treating ADHD. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that can help individuals with ADHD address these issues. It teaches practical skills to manage symptoms, like how to maintain organization, improve productivity, and cope with stress. For children with ADHD, behavioral therapy and parent training can also be beneficial in managing symptoms and improving quality of life. Let's not forget the importance of lifestyle changes in managing ADHD. Regular physical activity can improve brain function, reduce symptoms of ADHD, and increase the effectiveness of medications. A healthy diet, rich in fruits, vegetables, lean protein, and whole grains, can also support brain health and improve symptoms. Furthermore, maintaining a consistent sleep schedule can help regulate mood and improve focus. Another essential element in a comprehensive ADHD treatment plan is social support. This can involve joining a support group, seeking accommodations at school or work, or educating friends and family about ADHD. Social support can provide a sense of belonging, reduce feelings of isolation, and foster a better understanding of the condition. Moreover, complementary therapies are gaining recognition in the treatment of ADHD. These can include mindfulness and meditation, yoga, biofeedback, and certain dietary supplements. Such therapies may help reduce symptoms and improve functioning, especially when used in conjunction with conventional treatments. It's important to note, however, that these should be considered as part of an overall treatment plan and not as standalone solutions. And lastly, education about ADHD is a key part of treatment. Understanding the nature of the disorder, its effects, and strategies to manage it can empower individuals with ADHD and their loved ones. It can also help reduce the stigma associated with the condition. In conclusion, treating ADHD is a multifaceted process that involves medication, therapy, lifestyle changes, and social support. It requires a personalized approach that takes into account the individual's symptoms, circumstances, and preferences. With the right treatment plan, individuals with ADHD can manage their symptoms effectively, improve their quality of life, and reach their full potential. Remember, while ADHD can be challenging, it's also associated with many strengths, such as creativity, enthusiasm, and the ability to think outside the box. With the right support and treatment, these strengths can shine through. Treatment is crucial, but can ADHD be prevented? Let's delve into that in our next section. Is it possible to prevent ADHD? This question often comes up in conversations about attention deficit hyperactivity disorder. The reality, however, is that there's no definitive way to prevent ADHD, primarily due to its complex nature. ADHD is believed to be caused by a combination of several factors. These include genetics, environmental influences, and issues with the central nervous system at key moments in development. Let's talk about genetics first. Research indicates that ADHD tends to run in families, suggesting a strong genetic component. If a parent or sibling has ADHD, there's a higher likelihood that other family members may also have the condition. However, having a family history of ADHD does not guarantee that you will have it, and vice versa. Prenatal care plays a significant role as well. Certain behaviors during pregnancy, such as smoking, drug use, or excessive alcohol consumption, can increase the risk of having a child with ADHD. Pregnant women are encouraged to maintain a healthy lifestyle, including a balanced diet, regular exercise, and avoiding harmful substances to reduce the risk of ADHD and other health complications. Then there's the early childhood environment. Studies have shown that children exposed to consistent high levels of stress, severe neglect, or abuse may have a higher risk of developing ADHD. Providing a stable, nurturing environment can help mitigate this risk. Another important factor is the child's diet. While there's no definitive evidence linking diet to ADHD, some studies suggest that certain food additives and high sugar intake may exacerbate ADHD symptoms in some children. It's advisable to maintain a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. Lastly, brain injuries have been associated with ADHD. While not a common cause, children who have suffered a brain injury may show signs of behavior similar to ADHD. In conclusion, while it's not possible to definitively prevent ADHD due to its multifactorial nature, understanding the potential risk factors and maintaining a healthy lifestyle can help reduce the chances of developing the condition. While there's no surefire way to prevent ADHD, understanding and managing the condition can greatly improve quality of life. ADHD is more than a collection of traits and signs. It's a complex condition that affects millions of people worldwide and can significantly impact one's quality of life if left untreated. But let's take a moment to reflect on what we've learned today. We started with understanding the traits of ADHD. It's not just about being hyperactive or impulsive. People with ADHD often struggle with maintaining focus. They might be forgetful and tend to make decisions impulsively. They may also have difficulties with organizing tasks and activities, and they often avoid tasks that require sustained mental effort. We then moved on to recognizing the signs of ADHD. It's critical to remember that these signs can vary from person to person. Some may display hyperactivity, while others might struggle with inattentiveness. And in some cases, individuals might exhibit both. It's also important to note that these signs must be chronic or long-lasting and cause the person to fall behind normal development for their age. Next, we delved into the treatment of ADHD. There's no one-size-fits-all solution, and the best treatment plan is often a combination of medication, psychotherapy, education or training, and a healthy lifestyle. Medication can help manage symptoms, while psychotherapy can assist with coping strategies. Education or training can help people with ADHD and their families understand the condition, and a healthy lifestyle can improve overall well-being. We then touched on the prevention of ADHD. Although there's no surefire way to prevent ADHD, certain factors may reduce the risk. These include avoiding alcohol, tobacco, and drugs during pregnancy, protecting children from exposure to environmental toxins, and providing a nurturing and healthy environment for children to grow and develop. As we wrap up, it's vital to emphasize the importance of understanding and managing ADHD. Knowing the traits and signs can aid in early detection, which can lead to more effective treatment. Understanding the various treatment options can help individuals with ADHD and their families make informed decisions. And being aware of potential preventive measures can contribute to a healthier and happier life for those at risk. ADHD is a journey, not a destination. It's a condition that requires understanding, patience, and perseverance. But with the right knowledge and resources, it's a journey that can be navigated successfully. Our conversation today is just the beginning. There's a wealth of information out there, and I encourage you all to continue exploring, learning, and sharing. Remember, knowledge is power. Share this video to spread awareness about ADHD.